Good morning. My name is Dr. Chris Lemoh, and I'd like to welcome you all to the World AIDS Day Community Forum from Living Positive Victoria and hosted by the Burnet Institute. Really great to have you all here along with us. First of all, I'd like to acknowledge the traditional owners of the land that we're meeting on. So I'm on the land of the Kulin Nations, and I'd like to acknowledge their elders past and present, and any Aboriginal and Torres Strait Islander people who may be present, and just acknowledge that sovereignty was never ceded and that this always was and always will be Aboriginal land. So as I said before, so my name is Dr. Chris Lemoh. I'm an infectious diseases physician and also a member of the Victorian African Health Action Network. We've got a very illustrious panel with us today to discuss issues around HIV, and we're living in the midst of another pandemic. So we've got Hope Mathumbu, who's another member of the Victorian African Health Action Network. She's a health promotion and community development professional and also studying nursing, originally from South Africa. We've got Valentina from Living Positive Victoria's Speakers Bureau. Also have Carol El-Hayat, an epidemiologist and researcher from the Burnet Institute. We have Vicky Saputra, also from Living Positive Victoria, and we have Tafi Marukutira, who's a researcher at the Burnet Institute as well. Just ask everybody to please keep yourselves on mute if you're not speaking, but we'll be just having a series of conversations about the issues that have come up for us all this year and what we can take forward. If anybody would like to comment, please feel free, and we'll hope to have a lively discussion this morning. So first of all, Hope, I know you've been involved in various capacities in HIV for many years, and you've also been in the thick of things with the COVID pandemic. So it's affected every aspect of life, really. But what issues have stood out for you about the COVID epidemic in Victoria from your perspective, and how does that sort of relate to your experiences with HIV?
Thank you so much, Chris. Thank you to Living Positive Victoria and the Burnet Institute. Well, I think that what I've seen, so there's just two things that I'd like to touch on quickly. I think that it was really evident that community are much quicker and better at mobilizing than the government does, and that the government isn't really good at listening to and knowing who the community are. And I think, the biggest example of that for me was the quick mobilization that the community that was supporting the residents of the towers that were locked down before everyone else. The speed at which they got translated materials to each other, the speed at which people sort of formed mutual aid groups and the like to sort of help each other out. When there was a lot of people who were really traumatized by that experience, needlessly, really. And I think that then flows on to the second thing, is just the punitive approach by the government that also led to a lot of stigma and discrimination amongst people, and a lot of finger pointing. And I think that the thing that people forget is that, I think that no one is safe until we're all safe. And I think that the response for COVID didn't come from a safe and inclusive and good place. When you kind of think about the fines that were given to people, the finger pointing and the blame game, instead of just going, okay, here's a setback, we just need to get back to work. And we see that this kind of punitive approach leads to people maybe not getting tested when we need them to. It leads to people not really having confidence in doing the right thing. And, I think that everyone, no matter if you're a doctor or a nurse or whatever, at some point in time, there were odd bits of people who were always doing the wrong thing. But we like to, maybe blame two young African Australian girls who went to Brisbane and that sort of thing. And when you look at that racialized element as well, there's a lot to unpack there with the racialized elements of when we hear about HIV and AIDS as it relates to Black African people as well. Whereas, you know, when people came back from their trips from Aspen and that sort of thing, their names weren't on the front of the newspapers and that sort of thing. So as a society, how we chose to sort of jump on board, you know, onto, you know, blaming people as well. And the government's punitive approach didn't help. And I think with HIV and AIDS, you can see that in the way that people from LGBTQI and other communities as well were treated back then, you know, through misinformation and all those sorts of things. So yeah, that's it in a nutshell.
Hope, I just wanted to, I like your point about the community mobilisation. And I just wanted to add to that when, you know, so partway through the second wave, when the government announced its aims for the pandemic and how that actually got people on board. So when we all found out that, you know, we were aiming for zero and here are the tools and this is how you get there, everyone was kind of behind it and had something to strive for. And I think that was really important and a really good strategy. But unfortunately, it was very mainstream. And we know that, marginalised and ethnic populations and so on really rely on messaging outside of the mainstream. A lot of it is as verbal, word of mouth and that sort of thing. So yeah, I agree with you that there were, there was some strong aims, objectives. There were things that people could get behind. There were tools that people were given, and strategies and so on to get there. But definitely the reach was far from adequate.
I definitely agree with you there, Carol. I mean, and I think that over the years, as Australia has become more multicultural, it also ties back into the messaging around HIV and AIDS, where we see that it's still very much just geared towards particular LGBTQ communities, where we know that there's a lot more serodiscordant couples who are living with HIV. Growing up in South Africa, the messaging around HIV and AIDS was for everyone. It didn't matter if you were from the LGBTQ community, it was for everyone. And so I think that for a lot of people from countries where maybe HIV and AIDS looks quite different, they come here and they think, oh, maybe it doesn't exist, or maybe, maybe it's fine and that sort of thing. And we're quickly seeing some of the problems with the way we've sort of messaged HIV and AIDS and the kind of options, wonderful options that people have here in this country. So I definitely agree with you that strategies around messaging, whether it's HIV and AIDS, continuing as now, and even the COVID pandemic, I think it's a big issue. So I don't know what you think about what we can do about that in terms of future messaging.
My feeling is that, and I think what you were saying about how we've become more multicultural, there is, so since the HIV pandemic, there was a whole, the whole theme around nothing for us without us, and there was a lot of community engagement, and Australia led the way really in that pandemic in controlling HIV, because it included populations and groups that were highly affected and highly at risk, and they were able to lead. And we saw that here as well with COVID, with the Aboriginal community controlled approach, and that was very successful. I mean, it had its problems because, really we were not very prepared for this pandemic. So the problems, I guess, were inevitable, but it achieved, the fact that the Aboriginal community could lead the response, had really excellent outcomes. And so the fact that since HIV and those communities, even within the high risk populations, there is more and more diversity occurring. But I feel that we have, so there's two things. So there's the lack of preparedness, I think, that we didn't have things in place, I guess, to communicate to diverse populations to begin with, to get those messages out there. And the other thing is that we always think about marginalised, vulnerable, diverse communities as harder to reach. and we always sort of approach it with a block rather than going, how are other people doing it, or how can we engage these people to help us, to teach us how to get messages to them.
So I'll just jump in there, but no, that's really interesting points to make. I mean, the diversity and the people who are left on the edges there. Valentina, you've got a lot of experience from a few different countries, and something that Hope said earlier about the contrast between Australia and other experiences around the world. So would you like to just ask Hope to sort of expand on that further, and share your experience as well, Valentina?
I think that definitely we've been like one of the things like they Hope and Carol were saying about the community and how everybody behaved during this pandemic. But definitely there is one thing that for me was like a sign of alert, and it's something that I saw all around the world. It's like that we still have a lot of stigma with HIV and AIDS. So I think that no matter where you are, even it's like in a third world country like Uruguay when I raised, or if you are in European countries or here in Australia, that sometimes I feel here that we are very advanced in how you feel that you can reach. Maybe some of you can later clear me better about that, but I feel that it's like the services about how you can approach to treatment and to the medication and the information that is around is very, very vital and very good. But at the same time, it's like now with this COVID thing, it's like we are still seeing that this stigma that is happening with virus. We all know about washing our hands and don't touch anybody and be aware. And sometimes you were in the street and you can feel like the people that, like looking at you like, you are coughing, or you look like you have something. And that for people living with HIV is like very, very make us remember about what we are living for and what is people living for 30 years. About that. So I think that we still have to make a lot of improvements about the stigma and the information. Because in this kind of, now we are really living with this, that nobody wants to test COVID because you don't want a positive test. So I ask you, Hope, what do you think that is like how, in Australia that we are much advanced in some kind of topics? How can we deal with the stigma that we still have that much things to do in order to fix that?
From my perspective, I think that decolonization is a big part of it. I think that social and economic disparities are also a big part of everything that we're seeing play out. So I think that it's and I think that when we talk about stigma and discrimination, those kinds of things are so complex, a complex set of attitudes and beliefs. Like what you're saying, I agree with you. Right now, it's a very windy day. I've got asthma, and I did a lot of unpaid placements. I did a lot of care work and that sort of thing. And I had this constant fear that people would see, me sneezing or any kind of response, physiologically as a sign or a symptom of COVID. And that really scared me for a very long time because of the fines as well, because I want to be seen to be doing the right thing. But at the same time, as a casual worker, I also had to keep working. And I could also understand people needing to keep working because the government wasn't paying us. So I think that social and economic disparities are also a big problem that continuously fuel stigma and discrimination as everyone is trying to get back to the back to a normal life or back to a normal this. I think that it was very sometimes the othering of people. Which is again tied to, it's tied to racism. It's tied to a colonial mindset. othering and not really seeing people as people and trying to help everyone and kind of going, okay, we're in this together, and really assessing the risks of what we're talking about, who is at risk, and really protecting those people. And I think, you know, again, it was just up to communities to do that themselves and face continuous, I mean, Carol, you spoke about, you know, Aboriginal community-controlled approaches, and to this day, everybody's still going, what about Black Lives Matter? Well, there was zero source of transmission from that. And that was when people were talking about and really concerned about their human rights, you know, not going out to party or whatever. And in order to do that, they put in safeguards, things, you know, important things. You know, it took the government ages to mandate masks. It took them ages to do anything. When Japan was sending out free masks to everybody, you know. So some of the approaches have been very stingy, have been very unequal, you know, just focused on the bottom line, and it's been very sad. And I think that by really interrogating that, we can also maybe come further towards interrogating some of this stigma and discrimination as it exists in these, on these micro levels, on these.
Yeah, I think inequality has been certainly one of the main features. So Valentina, I mean, I think, how does Australia compare with other countries when it comes to inequality around HIV?
I think that definitely it surprised me when I arrived here a year ago. Really surprised me, like all the work that you are doing, compared at least with the country that I came from. Really like positive Victoria, like how the community is involved in approaching the HIV, and of course the access of medication and the programs. And I think that, as I asked you before, hope is like that is the way that we can. That is like the way that we can really get better about this. It's like getting small community groups, doing a lot of workshops, giving information to the young people, to the children. So because sometimes even it's like we still listen that the young people that we thought that they have everything okay, you know, with all the sexual education, that they will use condoms and they will have a safe sexual life. We still listen nowadays that it's not like that. It's not, because they really don't have the scare. They are not scared, or they are not as afraid of the virus as we used to be when we grow up. And now it's like they don't care. It's like a little like what is happening with COVID nowadays. It's like the young generations that they think that it's not as bad and it's not, can do nothing. It's like they say, okay, you are not dying of AIDS nowadays because there are good meds, so who cares? And that is what we have to change, that kind of mentality, that kind of ideas that are wrong ideas, and go and say, hey, we have this, all this research that have been done, we have all this information, we know that this is the way we need to behave about our sexual life. So that is the information that we have to give to the youngs and tell them it's okay to live with HIV. You can have a healthy lifestyle, but you need to take care of this. And it's good to have like a health providers that help you with that, you know, to make it easier. Like nowadays here in Australia, that you just call and they send you your meds in the post, and it's a safe way to do it. So if we can reach in a future to everybody have that kind of access, that would be like a dream come true for us. So I don't know if any other of you like think about like how it's like in Australia, what is like the main struggles that we have like for the people living with HIV in here.
Yes, I'm completely agree with Valentina in terms of the inequality access to HIV prevention and treatment compared to here in Australia and back in my country in Indonesia. We have a very limited access and even information about HIV prevention and treatment. And the first time I heard, for example, based on my experience, the first time I heard about PrEP or antiretroviral drug about HIV knowledge is like very limited back in Indonesia. Maybe I just received about a couple of hours back in high school in terms of sex education or HIV education. And yes, even I heard from my friend back in Indonesia that he received this expired HIV drug from his doctor because of the shortage of the medicine during this COVID pandemic. And yeah, I think the main reason why back in Indonesia we have a fairly limited access to HIV because our culture as well. In our culture, talking about sex, about STI is a very taboo topic, which could lead to the high level of stigma back in Indonesia. And Valentina, you mentioned about the community engagement, right? In order to respond, in order to include everyone in the response of HIV. What do you think of the government role? Because I think the government role is one of the key aspects to include everyone in the response of HIV in the community.
Well, yes, that's for sure that the government is one of the main educators, no? As together with the family, with your home, is where you receive your most education and how you are later going to deal with these kind of things. If we have a government that really make us easier and give us the possibility of reach that kind of information and make it easier for parents, for families to get that things, and so they can help to educate your kids. That for sure, that is a main issue for the government to be done. It's like, but still, it's like as you said about your country in Indonesia, I totally it's kind of what I think that is happening in a lot of countries, and that is what is really make you sometimes living in like in a bubble. Sometimes
Yes.
here in Australia. And of course, I'm sure that there are a lot of communities, like you said, like they're Aboriginal. I'm not very still like in contact with that kind of communities, but I'm sure that they struggle. I've been studying about more the addiction problems that we have, that there is in the community. That is another task that I think is like, it's more like if the government make like a plan for health. It's like, it's more about the well-being of a human, no matter where, how you are, which is your preference in every sense. It's about being a healthy, be able to do sport, be able to want to take care of yourself. And that is what we all as a human beings, and more people living with HIV, we really have to take care about how our well-being and how we take care of our body and our soul. So that is what totally is like what you said. It's like the government have to be really involved in that issues.
Yeah, I think I share the same sentiments. I think in as much as governments have a role to play, I think the communities also have a critical part to play. I think when it comes to, inclusion, we have always been talking about leave no one behind when it comes to the HIV response. I think it's always important as well to stress, it's not just about treatment, it's prevention as well. And we're talking of involving the communities for prevention, and then for those that test positive, living with HIV, giving them access to the treatment as well. And I think like Vicky mentioned, the issue around PrEP. For many people, they didn't even know what is PrEPing, coming in from other countries, let's say into Australia, starting to hear about PrEP. And it is important for that part, which is critical for prevention, for everyone to be included. We know back where I come from in Zimbabwe, in Botswana, we have made significant strides in making sure that everyone is included. And we know migrant populations are a priority population that needs to be included as well for prevention as well as for treatment. So I agree, Valentina, I agree, Vicky, with that specific discussion. I think for me, the question is always, how do you bridge the gap, or how do you interface, making sure that the community is included as well, or leading?
Yes, Yes, I'm completely agreed as well regarding government role. But yes, I think the government role and the community role in terms of response of the HIV issue need to be balanced, because I believe as well that community engagement without the government support would be quite difficult to promote the HIV issue in the community. Because yeah, like back in my country, which has a strong and strict culture about this kind of thing, about sex especially, which is a very taboo. And yeah, with the government support, I think that people could see how serious and important the issue is, I meant. Yeah. And Tafi, in terms of improving the understanding of HIV in the community, what do you think we could do in terms of improving the HIV understanding beyond the LGBTQI community in this 21st century?
Yeah. I think when we working with communities, language sometimes comes as a barrier, and we know as well our backgrounds, our cultural backgrounds come in as a barrier as well. And it is always important when we are communicating with people that they understand us, speaking their language or using an interpreter. And we know here in Australia, we know there's certain population groups that are essentially being left behind. So for example, migrants, so people born overseas. And we know coming to Australia, you can come in as a permanent resident or converting to citizenship. But we know that specific group of people that have no access to Medicare or that do not have Medicare will not have access to any of these. And most of them would be either students on short-term visas, visitors on temporary visas as well. And within this particular group, two things will come into mind: language and the fact that they do not have access. So again, when you talk about access, it's across all the continuum of care.
In order to increase or improve the understanding of HIV, I believe apart from language, I think we need to another key aspect is education. And because I'm not quite sure here in Australia, but back in Indonesia, like I mentioned before, I have very limited exposure to HIV and sex education. Therefore, I think sex education or STI, to improve STI and HIV knowledge in the education system, it's very important as well. And then in terms of from the community, I think the continuous campaign from the community, for the community, in order to promote this HIV issue also very important. For example, like Positive Speaker Bureau from Living Positive Victoria, we are, as a speaker and presenter, help to reduce stigma, discrimination around HIV, and by telling our story and experience as well. Yeah.
No, I think once we start moving to stigma and discrimination, I think it's a big one. And it's unfortunate that we have been talking about issues around stigma and discrimination for a long time now with HIV. And even when COVID came along, we still saw the issues around stigma and discrimination. I think, Carol, you wanted to add something on that?
I was just thinking about your point about the migrants and the Medicare ineligibility. And now we know that, there have been announcements made about ART access for temporary residents. There's also now PrEP clinic at the Alfred. And this comes from our knowledge and experience and research around biomedical prevention and how it works and who doesn't have access to that. It's a systemic problem, and they've made a step toward that. But I think just going back to government's commitment, I think it's really, really important. What you're saying is important in terms of stigma and people from different backgrounds and different barriers. But if there's no commitment and investment in researching and understanding the gaps, and the gaps being how do we get these really successful, really successful and available prevention and treatment tools, how do we get them to the people that need it? I mean, how has this ART announcement been made? Who has it been promoted to? If I come from a country, to study here? Will I know about it? How will I find out about it? Those things I don't think have been addressed or answered. And that's where we need to actually get in touch with people who are in these high-risk communities and bring them on board and ask them and treat them as experts in what they need and find out, you know, in detail. Like, this is where we need research now. How do we get, because we know stuff works, but how do we do it in a way that it's accessible to everybody, you know, people have equal access, and everybody is getting the benefit of already existing prevention strategies and support.
Yeah, I think it is a critical point that you mentioned. We have the tools, we have you know, the treatment, we have the prevention you know, approaches that can be accessed, and people can use that, and we can essentially get to zero. And I think we have alluded to the fact that as Australia, we are doing well, but there are those pockets of, you know, groups of people that are essentially being left behind. So when an announcement like that, Carol, comes on board that says, well, you can access PrEP at the Alfred Hospital, there is a PrEP clinic there. How do we get that message across to the community? And I believe that it is that bit of community engagement, with working with the community, involving the community, but also taking leads or getting the lead from the community as well, in order to understand what are the community needs and how do we get through to the community, whether it's language, whether it's culture, or whether it's just that aspect of you know, community engagement. And I think it is frustrating to keep going the same, you know, things that we've been talking about in the past, as in community engagement. How do we get the community to be involved, and yet the community is there waiting for us? So I don't know if anyone else has got anything to add on how do we get to reach the community, or how do we get that part of our community engagement?
I think, you know, there's so much evidence already about what social barriers are, what systemic barriers are, but I feel as though what's missing from that is the detail for individual, like for people, for the person. So even within a marginalised group or within a small ethnic community, there's also a lot of diversity. So where is the research, I guess, or the engagement to find out what, say, a mum of 5 kids might need for her, you know, Valentina was talking about being able to call and get your ART delivered. Like, does this migrant woman who speaks no English, who has, you know, maybe doesn't have time for the internet or television or whatever, does she know that she can do that, or will her treatment be interrupted? So it's about not just people like us identifying communities and thinking up some way to get stuff to them. It's about going out and talking to people, or getting or inviting them in, or, you know, do they need outreach? Do they need translation? Do they need, I mean, everybody needs health literacy. That's, you know, I mean, even if your English is your first language, you still don't understand everything, and not all messages come to you. So I just feel that, you know, we're pretty close. Like, we look at the EPI, we look at all the data, and it says that, you know, we're almost at 95% this, that, or the other, but we're not there. There's still people, like you say, who are being left behind. There are still people who somehow are excluded, and they will continue to be unless we really start to go, right, now we're almost there. Let's really put the commitment and effort and money and time into this and do it right. You know, like, we've been saying the same things for a long time.
Yeah, I think the reason why people are excluded is because we are a country and a society that's built on exclusion. So I think that I think part of the problem is that sometimes we use this homogenizing language. You know, we homogenize Aboriginal and Torres Strait Islander people. We homogenize, you know, what is this community that we speak of, you know, and knowing that, you know, lots of people, you know, sometimes, for example, you know, I've got lots of South Sudanese friends. They ethnically South Sudanese, but a lot of people may have grown up in Egypt or in other countries, or in Kenya. And so some people only speaking Swahili and mostly identifying as Kenyan. And then, of course, on top of that, you've got like some of those intergenerational things now, whereas, some young people, like what we were saying, some of our cultures are still, or some of our backgrounds, like anyone, I guess, who comes from, you've got your grandma and in your grandma's time, maybe going out to the disco wasn't as cool as it is now, and you're a fast woman and that sort of thing. So I think that we don't really understand who, like, people in our society, because I think we tend to want to just homogenize things and make it easy for us in terms of a public health response. And I feel that as well, we're not paying people to do the work, the people who are right there. Bilingual health educators, a lot of the time, for instance, like maybe working in aged care or in hospitals and that sort of thing, smatterings of a different language is really important for me to know, to communicate with elderly people who may have once spoken English and now don't speak English anymore and may have regressed to their own language. And so I think that as a society, when we talk about what matters and who matters, we are not having those real and honest decolonized conversations. And I think, that's a real big problem. And until those kinds of structural things can be addressed at the top, and until someone, hi Jen Johnson out there, talking about people giving up some of that power and recognizing they positions of privilege, and maybe stepping back a little bit and saying, the world that we're living in looks a bit different, and maybe I don't know everything, and I just need to step back and be happy supporting, and not having to take up that space in the front. And I think maybe things would be better. I don't know, and trusting the people who are, living with those experiences as well. And those people may identify as being part of a community. It may be a skating community rather than an ethnic community. Who cares? I mean, just listen to them and see the person in front of you. And I think very much what you're saying, Carol, as well, and what Valentina's saying, I think that distance is a, might be a bigger challenge for people as well. Mikey, affordability of stuff, some of those practical real world things are another big thing. And maybe how we deal with technology as well, like trying to incorporate technology and some of those postal services to reach people rather than say, you need to come to us and that sort of thing, and make things more easier for people to interact with.
Thank you, Hope, for that. If you, what you said about, I think that the community is something that we all agree that is very important. And one thing that we've been talking about before this forum is about like the spirituality. And I think that is one of the, because we are all the time trying to say like the Aboriginal community, the ethical, the immigrants, this, but at the end, we are the same. We are human beings, we are persons. And we still, I lived that here when the COVID, it's like I've been living in regional Victoria, and it was like people from Melbourne and people from regional Victoria. So we really like to segregate, and we really, sometimes as person, we like, or not myself really, I try not to do it, but we really like to segregate and to separate in different compartments. Oh, they are like from LGTB, they are like this, they are from regional, they are from Africa. And it's like at the end, we are all the same. We are all people living in and trying to be the best that we can and the happy that we can. So I think like at the end, what I would like to add, or what I would like to bring to the community and to this country and to my country, my original country, is like this sense of spirituality, this sense of that the real thing that we can do is like the connection. And even that we now have all these tools to be in touch with others, it's like there's nothing like the connection. And you really can feel there doesn't care if you do it by Zoom, if you do it by post, if you do it by a hi in the street. It's about how we get in touch with the other one. And that for me was, when I discovered about that, it was like it's like a black and white in my life. The day that I discovered my spirituality, my spiritual side, And it was what at the end makes me heal, and what helps me in with my HIV living, with my other stuff living. So I think that if we can help, and of course that the government have a big impact in our education, it's the way that the government is only like a tool to get reach to some things. But we as individuals, as each of us, we are the totally responsible of trying to get what we want for us and for the people that is around us. So that kind of human connection is what we really have to reach. And when you have that spirituality, and when you have that human connection, you don't stigmatize anybody, and you don't care if the person is living with HIV, if it's Aboriginal, if it's white, if it's black, whatever it is, everything is the same. It's just that connection with the other one. So I think that now that the Christmas is coming, and it's like a big religious theme, that not for everybody, just for some, but it's like here in Australia, it's a big theme for not very religious, it's more for the barbecue and for the meeting with the families, the ones that have, or with friends. So I don't know if anybody wants to add something about like how it is, like how we can make that, how you feel about that connection, human connection, and the relation with have that living positive.
Valentina, I think what you're saying is really important and beautiful, actually, that it is when we all come together that, you know, stigma and barriers come down. And I just remember when I first started in HIV epi, I was told, oh, you epidemiologists are heartless, because all I cared about at the time was what boxes I could tick. You know, is this person in what age group? Is it, you know, what was their exposure? Where did they live? Like, all of that stuff is important, obviously, to characterize an epidemic and find out who's at risk, and you know, so that kind of creates that segregation that you're talking about. And segregation is created in a lot of other ways. And what you're talking about really is the inclusion, and that's what we want. So even though we're kind of in some ways forced to think about groups as being different and things, because we want to address their needs, because everybody sort of has different needs. But at the end of the day, it is all about inclusion and not leaving people behind. And part of, I think that stigma is really very closely related, because if we do take that approach that Hope was mentioning, if we do, you know, people with privilege, for example, if we do stop and go, we don't know everything, we need to find out more, and we need to get people involved. It's empowering for people outside of that. It's really empowering for them to be able to contribute, to be able to talk about what they need, and to feel that everybody's working together for that outcome, so that everybody has equal outcomes and we're all on the same path.
Yeah, thank you both so much, and I think I really agree with you, Valentina. So I did a master's of public health and kind of felt unfulfilled, because I felt like a lot of it was navel gazing and I wasn't really doing anything practical, right? And I went to do nursing. And I thought that it would make me a better person. And, you know, I grew up Pentecostal, Valentina, which is, which is a type of Christianity, evangelical sort of stuff. And but I'm a very spiritual person, even though I'm not a religious person. And it's really interesting to me, because this year Pope Francis, recognized the LGBTQI community, and I'm really into liberation theology, and Pope Francis is a very sort of left sort of person, but kind of going through the nursing degree, and especially here in Victoria, when you look at that relationship between healthcare and Catholicism, it's really intense, and some of the ongoing stigma and discrimination that's pushed through unfortunately, religious views that people are allowed to sort of, and it's fine to be religious, but to me, that spirituality that you're talking about, Valentina, that real service is really why I went into sort of healthcare and nursing and that sort of thing. And I really can't imagine for the life of me why people would want to believe in this higher power and not let it fill them with a love for everyone, if that makes sense. And so, but at the same time, I guess I'm battling with religion and colonization and what that has meant for my people and my identity. And so when I talk about this, I'm definitely not talking in a Christian sense, the way that I believe. It's a totally different thing. And when you sort of look up liberation theology that comes from Latin America and the kind of Catholicism that comes from Latin America and the human rights justice that comes from that kind of belief, that gives me strength, not this kind of Catholicism that I've been attacked with throughout my studies in nursing, and that I find with all these people, who through their beliefs they can deny other people healthcare. It's just ridiculous. And now Pope Francis has come out and said this thing, and I think that it's really great. But anyway, look, it just got me thinking, and thank you so much for sharing that thing about spirituality, because I think like you. But Vicky, you were talking about, having come from Indonesia, and of course the religious landscape there is different. So what are your views?
Thank you, Hope and Valentina, for your sharing. It's really beautiful experience. And yeah, speaking from my experience as a Catholic, I believe that a support from the spiritual or faith-based community or organization is fundamental. Because for me personally, as a Catholic, and it's mirroring from you, Hope, as well, regarding believing to a higher power, that my faith as a Catholic is one of the things that give me strength until this now, especially during my dark times, especially when I diagnosed with HIV. Okay, and yeah, I receive a great deal of support from a Catholic community here in Melbourne, especially from the church I went to usually here in Melbourne. They held a very specific Catholic mass for people living with HIV every month. And then I received a great support and a great support from the organization I volunteer with, which is Acceptance Melbourne LGBTQI+ Catholic. And after I disclosed my HIV status to them as well. And surprisingly, one of the priests in my church, he is very well informed regarding HIV treatment and prevention. It's really surprising for me. And yeah, so receiving this great deal and amazing support from the Catholic community for me is like a great deal and making a difference for me, really making a difference. And yeah, so therefore I think that it's very important as well to educate and inform people in the spiritual or faith-based organization, so those people can help people, can support people living with HIV with their own unique way.
What you were saying about is really important, that we each of us just need to find where we find that we are comfortable, like which means of spirituality. For me, it's like I found my spirituality in the nature. It's like I like to surf and I go out, and when I paddle, I found that I'm in a better place. It's where I found my tranquility, and where I found it's where I heal, really. If something is bad with me, I just go to the ocean and I heal. And that is talking about that. It's like, now that I'm saying that, it's like one thing that I would really like to add to HIV and how we can make a better approach with everything. It's like, I think that we really need to take care more about our body and how we take care of that. It's like, and it's like the things that we ate, the things that the exercise that we do. It's like, that is something that the community, I think sometimes I found that people struggle a lot because most of the times it's like a new, that is the good thing that is people doing here with the new, when you just know about your status and they tell you that you are positive, it's like sometimes it's like you don't understand how you are going to live with this. So making like a very impact is in exercise and going out and showing. And in Australia, all the landscapes are beautiful. It's like the places, the beach, the water, even the little parks that are in the city, they are like, you can find there with the birds and with the just with the nature. You find in a little piece of the city, you can find your spiritual place in that where you are. And that is like one thing that sometimes, yeah, we get like try to make more like scientific and more like structural in some ways, but sometimes like just try to get to the community, these little things that we have very handy, and that are the things that can help us, like just to connect about the spirituality and connect to ourselves. And once that we are connect with ourselves, we can be able to connect with the other one, and then it's where you got that this big network. Yeah, you have the net, and it's like when one can help the other one, and we are all helping each other. And that, I think, is like one of the things that really needs, that I would like to see more like improving. If you allow me to say one thing that I would like to improve, is like, as we talk with the stigma, but I think all this stuff come together at the end. That is like the main goal, about being able to talk about it without shame. And if you are healthy in your mind, in your body, in your soul, you can do everything. So that is what, at least, is my main goal, is like to be able to get to the other generations, to the other people that is coming with me in this trip, just to share all about this. And yeah,
Thank
just
you.
try.
That's really, I mean, it's really important. I think that's probably the heart of the whole thing. I mean, one thing that we've been all reminded of is how important the connections are with each other. I mean, this last few months in Victoria, where we've been all forced to stay apart from each other and find ways to reach through technology to maintain those connections, has been one of the key themes of this entire year. And it's also, the other thing, of course, that's highlighted, stigma and inequities that we've all been talking about for decades now. So Tafi, I'll just ask you, do you think now that everybody's focused on this now, is this an opportunity that we've got to do things differently?
I think definitely this is an opportunity that we have had when you look at what we have had with the HIV pandemic, and then comes along the COVID pandemic. Obviously, the COVID pandemic has sort of, highlighted the inequities that are there. There is a lot that we can learn from the HIV pandemic, and there's also a lot that the response that we have had with the COVID pandemic, we can then, translate to. I think one sentiment that has been shared earlier on was, with the HIV pandemic, we never get tired, because you can imagine how long the pandemic has been with us, and COVID came along late last year, throughout this year, and just with simple strategies of saying stay home or do this, people have had pandemic fatigue, if you like. And yet we know with HIV, people still need to get it tested, or people still need to go to the clinic to get their medications and all that. And you never get tired, because there are benefits that actually come out of taking your medication. So test, and test. And when you look at what has happened with COVID, with some countries, Australia included, where testing for COVID was actually free for everyone, irrespective of who you are. And yet with HIV, the next question would be, where is your Medicare card? If you get COVID and you're sick and you're on a temporary visa, you will get admitted to hospital, no questions asked, if you don't have a Medicare card. And with HIV, it has been very different. And with where we are in Australia, we are now, we can learn a lot from Australia, how we have responded to the, COVID pandemic. If we could translate something similar to that, that says, leave no one behind, I think with HIV, we could go far as well.
No, thank you. I mean, I think it's actually one of the best things all year was the announcement this morning that that the government has decided to extend access to antiviral treatment for everyone with HIV who's in Australia, regardless of their residency status. And I mean, obviously the Commonwealth government and the state governments are going to have to work out the details of that. But just the simple fact that they've made that commitment now after so many years is such a wonderful thing. And I mean, I think it's been down to the community organisations pushing for it, the professional organisations pushing for it, and it's taken a long time, but it's come. And so I think one of the really big things has been that ability for government to listen to community and the professionals to listen to community, so that the science is based on the lived reality of people affected by the problem. And that way we ask the right questions, and we, like you and Carol, can answer them with proper study, but then translate that into action, meaningful action, because we've got the conversation being opened up between all of those different members of the partnership. And there are still people who are left out. We won't cover everyone, and just as there were still people who were left out of the support for COVID, which was really, really unfortunate. So look, I thank you very much for all your contributions. I think it's been really wonderful to see the different perspectives and the diversity within both the community and the professional, and the overlap between those two. I think one of the things that we probably all need to remember is that they, whoever they are not out there. They're not other people, they're us. And whenever we're talking about people who are hard to reach or people who are marginalized, it's because someone has marginalized them. If people aren't hard to hear, it's because they're not being listened to. And we all just turn around where we are, wherever we work, wherever we live. And there's somebody who knows something that really is worth knowing. And if we listen, we'll be told something that's important we otherwise would never have known. And I think that's one of the great lessons of this year. As an example of that, I think we'd really love to thank Living Positive Victoria for their generosity and their boldness in giving their place on today's program to people who come from the margins, and to recognise that even within the HIV community sector, there is still a main group of people who hold most of the influence, and for people who are in that position to step to the side and allow other people to come to the fore is a really wonderful example for everybody. And I hope that that everybody takes note of that, because I think that's how progress makes, how it happens, and that's how we will make those final % of people who are being left out and bring everyone in from the margins. I'd also really like to thank you all for bringing that nexus of spirituality to the discussion. We talk about the body a lot and the physical reality of our lives, but of course we're all people with a spiritual dimension, a psychological dimension, and we can't leave that out of the conversation, even though we work in a secularized sector, a secularized world. But we have to remember that people don't live like that. People live in the fullness of their humanity and in connection with everything around them. And if we leave that out of the discussion, then we really don't have a full conversation. So thank you very much for bringing that to the fore as well. And the language that we learn to speak together, if we expand that vocabulary, then we can say more of the things that need to be said. So I'd really like to thank you all, Valentina, Hope, Vicky, Tafi, and Carol. And love to thank the Burnet Institute, Angus, for your support, and Tommy, who's in the background supporting as well, and David O'Keefe for pulling this all together. Really love to wish you all the best for World AIDS Day. We remember the people that have not made it so far, but we carry their memories with us, and inspiration will never die. And there's a big program coming up at the Burnet Institute, which is a scientific program, but we just remember the meaning of this all is to help people live full and happy lives in connection with each other. So thank you very much.